Welcome to an exploration of neonatal nursing, a specialty that combines advanced medical technology with compassionate family care. Today, we'll examine what it means to work with the smallest patients during their most critical moments and discover how this field offers unique opportunities to impact lives in profound ways. Before we explore what neonatal nursing really involves, let's start with your current understanding. When you hear NICU baby, what images come to mind? Take a moment to think about this. Your responses will help us understand how this specialty is commonly perceived versus the fuller reality of what this work encompasses. Most people immediately think of tiny babies in incubators, complex technology, and premature infants fighting for survival. And you're absolutely right. Medical complexity does define much of neonatal nursing. However, while this clinical perspective is essential, it captures only half the story. There's an equally critical dimension that shapes every aspect of this specialty. Parents arrive expecting to take their baby home in 2 days, share photos with family, and begin normal life. Instead, they're navigating a world where their baby weighs less than 2 pounds and may face months of hospitalization. The disconnect between expectation and reality creates profound trauma extending far beyond medical concerns. Real emotional trauma manifests daily in parents throughout the NICU. They question everything. Did their actions cause this? Can they learn to parent such a fragile child? Perhaps most devastating is leaving the hospital empty-handed. Parents frequently describe this experience. I started sobbing as soon as I got in the car. This is not how it was supposed to be. I was leaving behind the love of my life. Your role as a neonatal nurse expands far beyond traditional bedside care. While providing expert medical care to critically ill infants, you simultaneously guide parents through the most challenging experience of their lives. You become the interpreter of complex medical information, the steady presence that helps parents believe in their ability to care for their child, and the professional who helps preserve family bonds during crisis. Neonatal nursing encompasses care for newborns facing serious medical challenges from birth. You'll encounter each condition regularly, from extreme prematurity requiring months of intensive support to full-term infants with complex heart defects needing immediate surgery. While the neonatal period technically covers the first month of life, many of your patients will require specialized nursing care much longer, sometimes extending to 2 years of age. 40,000 families each year face what we've just described, and survival rates have improved dramatically thanks to advances in neonatal nursing expertise. Medical progress means outcomes are 10 times better than just 15 years ago. These aren't abstract numbers. They represent real families whose lives are fundamentally changed by skilled nursing care. You become part of creating miracle stories, one family at a time. Premature infants represent the largest population in most NICUs and truly are the smallest fighters you'll encounter. These babies arrive before their organs are fully developed, requiring you to provide specialized care that supports continued growth and development outside the womb. Your expertise in caring for these tiny patients directly influences their developmental outcomes and long-term quality of life. Born at 22 to 24 weeks, micro-preemies weigh less than your phone and have skin so fragile that standard medical tape can cause injury. Their lungs aren't ready for air, their digestive systems can't process milk, and their nervous systems are still developing. Your nursing expertise and vigilance can mean the difference between normal development and lifelong disability. Genetic conditions truly are complex puzzles that require both specialized medical knowledge and exceptional family support skills. These infants often need care plans addressing not just immediate medical needs, but long-term considerations. You'll help parents understand conditions they've never heard of while coordinating care among multiple specialists and supporting families through overwhelming diagnostic information. Caring for infants with Down syndrome means understanding how this affects every body system. Metabolic disorders require precise monitoring of nutrition and medications. Congenital malformations typically involve multiple surgeries and complex recoveries. Your nursing expertise helps establish the foundation for lifelong management while supporting families through difficult decisions about their child's future. Maternal health conditions create additional complexity in newborn care that requires sophisticated clinical reasoning. These situations demonstrate how interconnected maternal and infant health truly are, and how your nursing expertise must extend beyond just the baby to understand the complete clinical picture affecting the entire family unit. Substance exposure creates withdrawal symptoms. You must manage pharmacologically while implementing comfort measures and supporting the mother's recovery efforts. Each situation requires both advanced clinical skills and emotional intelligence to navigate complex family dynamics while ensuring optimal outcomes for both mother and baby. Diabetic mothers create additional challenges with blood sugar management, while maternal infections can trigger newborn sepsis, requiring immediate treatment protocols. Maternal health directly impacts newborn outcomes in ways that extend far beyond delivery complications. When mothers have diabetes, their babies often experience dangerous blood sugar fluctuations and may be unusually large, creating both delivery challenges and ongoing metabolic instability. Maternal infections can cross the placenta or occur during delivery, triggering sepsis in newborns that requires immediate antimicrobial treatment and strict isolation protocols. Birth injuries from difficult deliveries necessitate ongoing neurological monitoring and developmental assessments. Substance exposure during pregnancy creates withdrawal symptoms in newborns that you must manage through careful medication protocols while supporting the mother's recovery journey. Maternal mental health conditions affect early bonding and complicate discharge planning, requiring coordinated care between obstetric and neonatal teams. Babies communicate through subtle changes in skin color, breathing patterns, and movement that most people can't interpret. A slight change in heart rate might indicate pain, infection, or equipment problems. You develop expertise in reading these nonverbal cues, often identifying problems before monitors alarm. Your assessment skills become life-saving diagnostic tools when caring for patients who cannot speak. Work environments vary dramatically based on patient acuity and hospital resources. Level 2 nurseries allow you to care for multiple recovering babies, while Level 3 units focus on 1 or 2 critically ill patients requiring intensive monitoring. Level 4 centers handle the most complex cases with specialized procedures. The pace is intense, decisions have immediate consequences, and babies need care around the clock, so expect 12-hour shifts including nights, weekends, and holidays. Neonatal nursing is fundamentally collaborative, requiring you to work closely with a diverse team of specialists who each bring critical expertise to patient care. Neonatologists provide medical management and make complex treatment decisions, but they rely heavily on your bedside observations and assessments to guide their choices. Respiratory therapists work alongside you to manage ventilators and airway care, especially crucial for premature infants whose lungs aren't fully developed. Clinical pharmacists ensure safe medication dosing for patients who may weigh less than 2 pounds, calculating precise doses and monitoring for drug interactions. Nutritionists develop specialized feeding plans that support optimal growth while working within each baby's medical limitations. Physical and occupational therapists focus on developmental care, helping position babies to prevent complications while supporting feeding skills and neurological development. Social workers provide essential family support and coordinate the complex discharge planning process. Your role as the bedside nurse places you at the center of this team, coordinating care and communicating changes in patient status that influence everyone's interventions. This collaborative approach ensures comprehensive care that addresses not just immediate medical needs, but long-term developmental outcomes for these vulnerable patients. Parent education represents one of the most rewarding aspects of neonatal nursing. Your teaching begins with simple tasks like mouth care, then progresses to complex skills like managing feeding tubes and recognizing illness signs. You help parents learn their baby's individual cues for hunger or discomfort. This education builds parental confidence, facilitates bonding, and prepares families for successful discharge after potentially months of hospitalization. Career advancement in neonatal nursing offers diverse opportunities, each building on bedside expertise while providing different professional focuses. Most nurses begin as staff nurses, developing expertise in high acuity care and mastering complex clinical skills. Charge nurses advance to lead shifts and mentor newer nurses, gaining valuable leadership experience. Nurse managers oversee unit operations and staff development, handling administrative responsibilities while maintaining clinical oversight. Clinical nurse specialists focus on evidence-based practice implementation and quality improvement initiatives. Developmental care specialists develop expertise specifically in preterm infant development, helping establish protocols that optimize outcomes for the most vulnerable patients. Discharge coordinators orchestrate complex transitions from hospital to home for medically fragile infants, working with families, insurance companies, and community agencies. Nurse educators shape the next generation of NICU nurses through orientation programs, continuing education, and competency development. Neonatal nurse practitioners represent the highest level of advancement, requiring graduate education, but offering expanded clinical autonomy and the ability to provide medical management alongside physicians. Neonatal nursing demands both intellectual rigor and emotional maturity. Your critical thinking abilities matter because patient conditions change rapidly, and decisions have immediate consequences. Emotional resilience is crucial. You'll experience profound joy when micro-preemies go home healthy, and sadness when families face difficult decisions. Communication skills help you translate complex medical information for frightened parents while coordinating multidisciplinary care teams. You really cannot anticipate the impact that you, as a nurse, have on the patients and families you care for and build relationships with in the NICU. When you're in the moment, teaching a scared mother how to change a diaper through incubator ports, or simply being present during a family's worst day, you're focused on the immediate clinical needs. But families remember everything. They remember your voice when you explained what the monitors meant. They remember how you helped them feel less afraid to touch their baby. They remember the nurse who made them believe their child would be okay. This invisible influence shapes how families experience one of the most defining moments of their lives, and it's something you discover about neonatal nursing only after you're in it. Long-term impact of neonatal nursing extends far beyond hospital discharge in ways you may never fully realize. Parents frequently return to the unit years later, proudly showing off healthy, thriving children to the nurses who cared for them during those critical early weeks. You'll encounter families in grocery stores or community events who recognize you and express gratitude for care provided years earlier. Many nurses receive holiday cards and milestone updates that continue for years after discharge. Perhaps most profoundly, every time parents look at their healthy child, they remember the compassion and expertise you provided during the most frightening period of their lives, even if they never have the opportunity to tell you directly. Professional rewards reflect what draws many nurses to this specialty and keeps them engaged throughout their careers. You witness medical miracles regularly. Babies who weren't expected to survive not only living, but thriving. You help families navigate crisis and emerge stronger. You contribute to advancing medical knowledge through evidence-based practice. Most importantly, you provide hope during families' darkest moments and celebrate with them during their greatest triumphs. Your pathway into neonatal nursing is well supported. Most NICUs actively recruit new graduates who show genuine interest and strong clinical foundations. Comprehensive orientation programs lasting 3 to 6 months provide intensive training in specialized equipment and family communication. Consider pediatric experience to build relevant assessment skills. The National Association of Neonatal Nurses offers student memberships with educational resources and networking opportunities. These questions challenge you to consider whether neonatal nursing aligns with your professional goals and personal values. This specialty offers the opportunity to advocate for patients who cannot speak while supporting families through experiences that will shape them forever. If you're drawn to work combining cutting-edge medical knowledge with compassionate family care, where your expertise directly influences whether families go home together, this field might be your calling.